Heart failure is a common disease with a lifetime risk of 1 in 5. Heart failure is also associated with a poor prognosis, with a 5-year mortality rate of at least 50%. Heart failure is also associated with a poor outcome. The cause of heart failure is diverse, ranging from myocardial infarction, valvular disease, but also monogenetic mutations are causing heart failure in 10 to 15% of the cases. In this study, we identify KLHL24 as a cause of heart failure. We present a case of a 17-year-old patient who was born with a severe blistering disease, but presented at our department with severe heart failure at the age of 17 years. 6 months later, he received a heart transplant. With the use of induced pluripotent stem cells and in vitro disease modeling, we were able to mimic the cardiac phenotype in vitro.
In the heart, we hypothesized that hyperactivity of KLHL24 mediates excessive desmin degradation. The cardiac homologue of keratins in the skin is desmin in the heart, and desmin forms an intracellular compliance network that prevents heart muscles from deformations upon hemodynamic loading. To mimic these loads in a petri dish, we applied the newly published dynamic loading platform to patient-derived engineered heart tissues. Now in health, we and the group of Adam Weinberg have recently shown that dynamic loading improves the contractile function, with tissues displaying uniform contractile properties. However, in patient tissues, dynamic loading resulted in thin, dilated tissues with non-uniform contractile properties. The desmin protein levels were significantly reduced, which corresponded with reduced desmin levels in the explanted heart of one of the patients.
In vitro modeling showed key characteristics of heart failure, including tissue dilatation and reduced contractile force. With 2 interventions, we were able to rescue the phenotype. One was direct desmin overexpression, but the other one was RNA interference against KLHL24. Both were able to rescue the phenotype. Given the clinical experience with RNA therapeutics, antisense oligonucleotides targeting KLHL24 may provide therapeutic opportunities.